Welcome to our channel, Sisums. In today's video, we're exploring the fascinating yet critical topic of tongue diseases. The tongue, while often overlooked, is a vital part of our overall health, and various conditions can affect its function and appearance. From common issues like canker sores and geographic tongue to more serious conditions like oral thrush and tongue cancer, we'll discuss the symptoms, causes, and treatment options for a range of tongue diseases. Stay informed and take control of your oral health with our expert insights and practical advice. Don't forget to like, subscribe, and hit the notification bell to stay updated on all our latest content.
Welcome back to our channel Sisums. Today, we're diving into a topic that's often overlooked but incredibly important: tongue diseases and conditions. You know me, I'm all about preventative care, and we often forget that our tongues need some love too. We use them every day to taste, swallow, and speak. But did you know your tongue can also reveal a lot about your overall health? From funky discolorations to persistent sores, we're going to cover 10 common tongue conditions you should know about. Knowing the signs can help you catch these issues early on and get the right treatment. So stick around, because we're about to unlock the secrets your tongue might be trying to tell you. Our first stop takes us on a trip to your tongue. Ever noticed your tongue looked like a map? That could be geographic tongue. Don't worry, it's not contagious, but it can be alarming. Named for the smooth red patches often surrounded by a white border. These patches can change shape and location, like continents shifting on a map. Usually painless and harmless, but some might feel mild sensitivity to spicy or acidic foods. If discomfort occurs, talk to your doctor or dentist. Most of the time, it clears up on its own. Everyone's tongue is unique. Let's move on to a condition that's a little less world traveler and a bit more unwanted guest. Oral thrush, also known as candidiasis, is a fungal infection that can pop up in your mouth, including your tongue. You'll recognize it by those creamy white lesions that resemble cottage cheese. They can appear on your tongue, inner cheeks, and even the roof of your mouth. Now don't panic. Oral thrush is actually quite common and is caused by an overgrowth of a type of yeast called Candida albicans. We all have this yeast in our mouths naturally, but sometimes things get out of whack. Things like a weakened immune system, certain medications like antibiotics, or even medical conditions like diabetes can make you more susceptible to oral thrush. The good news is, it's treatable. Your doctor can prescribe antifungal medications in the form of mouthwashes, lozenges, or even pills to clear up the infection. Remember, if you suspect you have oral thrush, don't try to self-treat. It's always best to get a proper diagnosis and treatment plan from a healthcare professional. Next up, we're tackling a condition that sounds scarier than it is: black hairy tongue. Before you imagine a furry mane sprouting from your tongue, let me explain. It happens when tiny projections on your tongue, called papillae, overgrow and trap bacteria. This makes your tongue appear dark and hairy in colors from black to green. The good news is, it's usually painless and temporary. Improving oral hygiene and using a tongue scraper can help. Staying hydrated also makes a big difference. A little extra attention to your oral health goes a long way. Now let's talk about glossitis, a condition where your tongue becomes inflamed, often appearing swollen and smooth. Glossitis can be triggered by a variety of factors, including allergic reactions to food or medication, infections, nutritional deficiencies, and even mouth injuries. You might experience symptoms like tongue pain, tenderness, difficulty speaking or swallowing, and even changes in your sense of taste. Glossitis can be a real pain, both literally and figuratively. The good news is that treatment usually depends on the underlying cause. If it's an allergic reaction, identifying and avoiding the trigger is key. Infections might require medications like antibiotics or antifungals. In some cases, nutritional deficiencies like iron or vitamin B12 deficiency can also lead to glossitis. If you're experiencing persistent tongue inflammation, don't ignore it. See your doctor or dentist to determine the root cause and get the right treatment. Early diagnosis and treatment can help prevent complications and get you back to enjoying your favorite foods and activities. Moving on, we're addressing leukoplakia, a condition characterized by thick white patches that form on the inside of your mouth, including your tongue. These patches can't be scraped off easily, which is a key characteristic. While leukoplakia itself is usually harmless, it's important to pay attention to it because in some cases it can develop into oral cancer. The exact cause of leukoplakia isn't fully understood, but chronic irritation from things like tobacco use, ill-fitting dentures, or even cheek biting can play a role. If you notice any persistent white patches in your mouth, it's crucial to see your dentist or doctor for a proper diagnosis. They might recommend a biopsy to rule out any precancerous or cancerous cells. The good news is that most leukoplakia patches are benign. However, early detection is key in managing any potential risks. So, don't hesitate to get checked out if you notice anything unusual. Let's face it, we've all been there. Those small, shallow sores that pop up on your tongue gums or inner cheeks. Canker sores, also known as aphthous ulcers, are incredibly common and can make eating, drinking, and even talking a real pain. While the exact cause of canker sores is still a bit of a mystery, factors like stress, hormonal changes, food sensitivities, and even mouth injuries can trigger them. Most canker sores heal on their own within a week or two. However, over-the-counter gels and creams can help alleviate pain and reduce irritation. If you're prone to frequent or severe canker sores, your doctor or dentist might recommend prescription medications to manage them. Remember, if you have a canker sore that lasts longer than 2 weeks, bleeds excessively, or is accompanied by other unusual symptoms, it's essential to seek professional medical advice. Now, let's talk about oral lichen planus, a chronic inflammatory condition that affects the mucous membranes in your mouth, including your tongue. This condition is thought to be an autoimmune disorder, meaning your own immune system mistakenly attacks the cells in your mouth. Oral lichen planus can manifest in different ways, but it often presents as lacy white patches, red, swollen tissues, or even painful sores. It can affect your tongue, inner cheeks, gums, and even your lips. While there's no cure for oral lichen planus, the good news is that it can be managed with proper treatment. Your doctor or dentist can recommend medications to reduce inflammation, manage pain, and promote healing. In some cases, lifestyle modifications like avoiding tobacco, managing stress, and practicing good oral hygiene can also help control the condition. If you suspect you might have oral lichen planus, don't hesitate to seek professional help. Early diagnosis and treatment can make a significant difference in managing symptoms and improving your quality of life. Now let's address a serious but thankfully less common condition, tongue cancer. Tongue cancer is a type of head and neck cancer that can affect any part of the tongue, and it's crucial to catch it early. Common symptoms of tongue cancer include sores that don't heal, lumps or thickening on the tongue pain, difficulty swallowing or speaking, and even numbness in the mouth. It's important to note that these symptoms can also be caused by other, less serious conditions. However, if you experience any of these symptoms, especially if they persist for more than 2 weeks, it's crucial to see your doctor or dentist immediately. Early detection of tongue cancer is vital for successful treatment. Treatment options for tongue cancer vary, depending on the stage and location of the cancer. They may include surgery, radiation therapy, chemotherapy, or a combination of these approaches. Remember, early detection is key when it comes to tongue cancer. Don't ignore any unusual changes in your mouth. Your health is worth it. Let's talk about fissured tongue, a condition where, as the name suggests, you develop grooves or fissures on your tongue surface. These fissures can vary in depth and size, and they might be present from birth or develop later in life. The good news is that fissured tongue is usually harmless and doesn't cause any major health problems. However, those grooves can sometimes trap food debris and bacteria, which can lead to bad breath or even increase your risk of developing a mild infection. The best way to manage fissured tongue is to practice good oral hygiene. Gently brush your tongue with a soft bristled toothbrush to remove any trapped debris. You can also use a tongue scraper to clean the fissures more effectively. In most cases, fissured tongue doesn't require any specific treatment. However, if you're concerned about the appearance of your tongue or experience any discomfort, don't hesitate to talk to your dentist or doctor. They can address your concerns and provide personalized advice. Finally, let's address burning mouth syndrome, a condition characterized by a burning or tingling sensation in your mouth, particularly on your tongue. It can feel like you've scalded your mouth, even though there's no visible injury. The exact cause of burning mouth syndrome is still not fully understood, but it's thought to be related to problems with the nerves that transmit taste and pain signals. It can also be associated with other medical conditions, medications, or even nutritional deficiencies. Diagnosing burning mouth syndrome can be tricky, as there's no specific test for it. Your doctor or dentist will likely rule out other possible causes before making a diagnosis. Treatment for burning mouth syndrome often focuses on managing the symptoms. This might involve medications to alleviate pain, mouth rinses to soothe irritation, or even cognitive behavioral therapy to help cope with the discomfort. If you're experiencing a persistent burning sensation in your mouth, don't suffer in silence. Talk to your doctor or dentist to get the help you need. So there you have it, 10 common tongue conditions you should know about. Remember, your tongue is a powerful indicator of your overall health, so paying attention to any changes is crucial. Thanks for watching. If you found this video helpful, don't forget to like, comment, and subscribe for more health tips and information. Stay healthy and take care of your tongue.